Hi. A few days ago, I suffered a very painful back injury called a lumbar lateral shift. Here's what it looks like from the back, and then here's what it looks like from the front. This is not me. This is two pictures that I pulled off the internet, but my back looked very much like this. In fact, my lateral shift was even more dramatic than in these pictures. And so today I wanted to talk to you about my current understanding of lateral shifts, maybe in hopes of helping you with yours. So it's important to understand this is probably the sixth or seventh time I've suffered a lateral shift. And it seems to me that once you have one lateral shift, you're more prone to lateral shifts in the future. At least this has been my history with them. And the people who I've treated in the clinic seem to have multiple lateral shifts based on their history. So what's going on here? Well, if you've watched any of my other videos about sciatic pain or back pain in general, you'll understand that there are two or three primary pain patterns that cause almost all back pain. One is an extension problem, and that means that you have too much arch in your back or too many forces trying to pull your back into an arch. And basically, if we're looking at the low back arch here, this is called the lordotic arch of the lumbar spine. Basically, it's either too pronounced or there are too many forces trying to pull it more into an arch. And this causes a lot of chronic back pain. Then the opposite of that is a flexion problem, where the lumbar arch is too little or there are too many forces trying to pull it out of its lumbar arch. And then the third pattern is a side bending problem, where one side of the pelvis is higher and usually the same side rib cage is lower, creating what I call a side bend pattern, and which then compresses nerves and discs on this side of the spine, causing sciatic pain, one-sided back pain, SI joint pain, and so on. At first blush, it seems that a lateral shift would be the same as a side bending problem, but it's not. When I was in the beginning stages of my lateral shift, I measured my pelvis and rib cage and they were both level, even though they were shifted to the side like this. Okay, so it's not the same as a side bending problem. So I want to go into first how the lateral shift happened. And this is pretty much how it's happened every time I've gotten one. I was simply standing at a kitchen sink, leaning over and cleaning out a pan in the sink. And I felt an immediate nasty twinge in my back, and I stood up out of that position and went over and sat down on one of our kitchen stools. Thankfully, our kitchen stools are higher than normal chairs, and so this allowed me to try to tilt my pelvis in a way that relieved pain, which worked for about 15 minutes, but I felt it was becoming progressively worse and spasmed, and so I asked my wife to set up my massage table so that I could go lay down on it. And then sadly, I needed to hold on to both of her shoulders while she walked very, very slowly to the massage table in the other room so that I could lay down in it. And at every step, we're talking 10 out of 10 pain here, I nearly felt like I was going to collapse. It was in so much spasm and it was so painful. And luckily, I've been through this several times before, so I wasn't panicking, but I understood that I needed to take care of this immediately. What I did was I laid down on my massage table on my stomach. And the reason I did that is that I felt that I was suffering from a disc bulge or disc herniation event. And these events are very, very painful and very acute issues. Disc issues, when we have a disc bulge or disc herniation, what I have learned is that these are usually acute episodes, meaning that they've just recently happened, such as when I just stood up there at the kitchen sink and got that jolt of pain. This is different than a chronic sciatic or back pain issue, because it's chronic is something that's lasted over 3 months. And acute means it's lasted less than 3 months. Well, mine lasted less than 30 minutes ago. So it was an acute episode, and I felt that this was a disc issue based on the level of pain that I was in and my inability to stabilize my spine or work my way out of it in the 20 minutes that I had tried sitting there. In that 20 minutes, it had become progressively worse and started to go into spasm. And I realized that this was a progressive problem, not a one-time thing that was done. It was getting worse and worse the longer I was sitting down. With acute disc issues, they respond very well to extension of the spine. And this was the case for me. I went down and laid down on my table, on my stomach, with a pillow underneath my chest, and just laid there in terrible pain. And that pain started to subside within about 5 minutes because I was extending my spine like this. Now, this is the opposite thing that you would want to do for most chronic back pain, because most chronic back pain is due to an extension problem where there is too much arch or too many forces trying to pull you into an arch. So normally in that situation with chronic back pain, you would want to lay on your back with your knees bent instead. All right, and usually that will relieve your back pain. But acute disc episodes respond very well to more spinal extension, which means that they are a flexion problem phenomenon, meaning that the spine is either too flexed or there are too many forces trying to pull it into a flexed position. And this is the case when I was cleaning out the pan and the sink. I was bent over and I wasn't bending my knees, and so my lower spine was rounded like this while I was bending forward, which then created the acute disc issue. All right, so lying on my stomach with a pillow underneath my chest, bringing my spine into as much extension as possible, started giving me relief from my symptoms within, like I said, about 5 minutes. I'm going to pause here briefly and ask you to please like, subscribe, and share this video with others who may be suffering from these types of issues or other issues that I've covered on my YouTube channel to help them too. Thank you. All right, so I've been laying down here and my symptoms started to abate within about 5 minutes. And basically, we're talking about going from a 10 out of 10 pain to maybe a 9 out of 10. So it wasn't a dramatic change, but it was enough that I knew that I had stopped the spasm that was starting to build in my lumbar spine almost immediately when I got into that position. Now, this brings up another point. One of the things that I tell most of the people who buy my home programs is, please get a massage table because it will always be a perfect platform from which to do your exercises, some stretches and so forth that I have in my programs. But also for me personally, having that massage table in my house for these episodes, even though they happen maybe once a year or once every 2 years, when I have these episodes, I need that table significantly because a bed is usually too low. You would have to bend forward to get down on that bed, and there's no way I could do that. I have the table legs set up so that the table is basically at my hip height, and so it doesn't require me to bend forward to get down onto the table at all. So once again, that table really saved me. Okay, so I'm lying down like this, and because I felt immediate relief lying on my stomach with my spine in extension with a pillow underneath my chest, I knew I was dealing with likely a disc issue. And at the very least, I knew that I was dealing with a flexion problem issue. Because again, if I had an extension problem, this would actually increase my pain. But it didn't. It decreased my pain. And so even though I chronically have extension problems for my back, this acute episode was a flexion problem. It's really important to be able to figure that out. And my experience with this over so many years has told me that this is the best position for me in these situations. That I spent basically the rest of the day in this position in just excruciating pain. Luckily, both of my kids recently had their wisdom teeth removed, and they had some extra hydrocodone left over. And so I took one of those. I took, I think, 2 of those that day, and that, I think, helped knock it down. I mean, I was in so much pain. I can't imagine what the pain would have been had I not taken that, because even taking those, I still had 9 out of 10 pain for the rest of the day. It was It was really awful. Anyway, so for those of you suffering from an acute episode of a lateral shift, spinal extension may help you. Now, why would spinal extension help me? Well, again, I believe that this is a disc bulge or disc herniation event that's leading to the lateral shift. And so the rest of this video will talk to you about, I'm going to talk to you about why I think that's happening, and maybe this will help you understand what you need to do. All right, so for the next, I'm now in day 6 of this event, and I still have a little bit of a lateral shift. It's not nearly as dramatic as what it was those first 3 or 4 days. The important thing to know here is that I didn't do anything to correct the lateral shift. You'll see many videos on YouTube and so forth, and on other websites that, that teach you to force the lateral shift back so that your spine is in alignment again. And every time I've tried that in the past, that has increased my pain significantly. And so it's told me that my lateral shift is actually protecting me from some structural problem going on in my spine. Now, what's interesting is during these first 3 or 4 days I was in this intense pain, my pain was central in my back. It was not on the left side or the right side. But now as my lateral shift is correcting and I'm coming closer to an aligned spine, and my pain has reduced significantly, now my pain is on my left side of my spine. Now, the thing that I think is interesting about that is that my lateral shift is to the right. So my lateral shift is to this way, and the more that I come back to center, the more pain I have on my left side of my spine. So I believe the shift is occurring because it's trying to get me away from whatever the event structurally is going on there. I believe it's likely a disc bulge of some sort or disc herniation to that side. So as my shift is correcting, I'm getting closer to alignment, but also I'm getting closer to pinching the remaining bulge or disc herniation that's occurring in that side of my spine. And so that's why I don't want to force myself over there, even though it's so tempting to do that, because it seems that my shift is occurring because of this reason, and me forcing it over will only pinch that tissue worse and cause pain. So again, my pelvis is level, my rib cage is level, so this is not a side bending problem. This is a lateral shift problem where everything is level, it's just shifted over. Now, a few years ago, I went to a spinal surgeon when I was in the middle of one of these lateral shifts. And I talked to the PA and I said, what's going on with the spine when the shift is occurring? And she said, there's almost no change in the alignment of the spine. It's very small, certainly not as much as you see in the picture that I had at the beginning here, or as much as my shoulder was literally this far. It was a significant lateral shift, and it's that significant every time it occurs. But on x-ray, my spine looks pretty close to an alignment. So this seems to be a muscular issue rather than a vertebral issue. And that's important in my understanding of what I think is going on with lateral shifts. It's not that there is something wrong with my spine. It is that my muscles seem to be responding to a painful event that's occurring at my spine by going into a spasm to get off of that problem. All right, so during these 3 days that I was in significant pain and lying on my stomach, anytime I would get up, I had to walk with crutches, and I didn't put them underneath my armpits. I walked with them as if they were like hiking poles, because I don't have hiking poles. At all times when I was not lying down on my stomach and standing, I would always have to have at least 3 points of contact with the floor, 2 crutches and 1 foot while moving, because if I had 2 points, that would require more stability from my spine, which I could not have because I was in so much pain. It was shutting down all my spinal muscles. And so the longer I was attempting to sit up longer each day to, get over this and feel like my life was more back to normal. But what I found was, for instance, that first day I was only able to sit up for maybe 5 to 10 minutes before my spine started going into spasm and telling me I needed to lie down on my stomach. The second day I could sit up for maybe 10 minutes to 15 minutes tops before I needed to lie down. And then the third day I was up to maybe 20 minutes total. But that was pushing it. After each time, as I felt my spine going into more and more, as I felt my spinal muscles going into more and more spasm, it felt to me that I was unable to stabilize my spine. And so walking during that time is fairly dangerous. In fact, I felt like I was going to collapse a few times because of the pain and the lack of stability and the spasming that was going on. So it's not something that you want to push. Me sitting up didn't help me correct my spine. It was just something I felt I needed to do mentally to feel that I was moving forward and getting over this. So what was correcting my spine was lying down on my stomach with my spine in extension. And what was interesting is also that the first day my spine had to be in extreme extension in order to reduce what I felt was a disc bulge or a disc herniation. And then by the third day my spine could be in this much extension to feel that release. So this was telling me that whatever was occurring in my spine was resolving because I didn't need to be in as much extension to fix it. And then by the fourth day I could lay on my stomach flat like this. On the fifth day I felt I could lay on my back with my legs straight because that also produces spinal extension. And then I could finally feel like I was getting more closer to normal once I could lay on my back with my legs straight and feel like that was pain relieving as well. But the first days I was in pain, this was absolutely the wrong position that I had to sleep in. And incidentally, sleeping at night, the first 2 nights I hardly slept at all because I was in so much pain. But I tried to lie on my back, and what I did is I rolled up a bath towel underneath my spine to force it into extension while I was lying on my back. And so that helped a little bit. And then by the fourth night, I had to remove that roll because it was too much extension for me. So as you go through this phenomenon, your responses to things will change, and it's important for you to observe those responses. My observations of my own reactions to what helped me initially and seeing that was changing was helping guide me as to what I should be doing next. And so while the first day I needed extreme extension, if I were to go into that extreme extension on the fourth day, that was starting to irritate my back. And so I needed to bring myself out of that extreme extension. So it's important to pay attention to those signals that your body is telling you. Yes, things like this can change that rapidly. In less than a few days, whatever event was occurring in my spine was improving. And this is the beauty of our body, is that pain is telling us that something is wrong now. And if you learn to listen to those signals now, you'll be able to guide yourself out of these situations. Again, the other signal that you would receive is if you watch any of those other YouTube videos about, if you have a lateral shift, to force it over like this, standing against a wall, and you have more pain, then don't do that. Because more pain means that you're doing something wrong, all right? That's your body's way of telling you, nope, this isn't right. Less pain means that you're doing something right, all right? And just keep that in mind. All right, so I was using crutches for those first 3 days. Actually, this is the first day I haven't used any crutches at all, to be honest. Yesterday I used them very sparingly, but the 3 or 4 days prior to this, I was very heavily relying on those crutches to help me unload my spine while I was up. And so I would recommend using, trekking poles or crutches or something to help you walk if you're in the middle of this episode or suffer from one of these in the future. Okay, so what I believe ultimately is that this is disc event because it responded to extension. And you'll see a lot of extension types of exercises recommended for people with back pain. However, in my experience, extension exercises do not help with chronic back pain. They only help with acute back pain. And because acute back pain is often due to these disc events, this is why acute back pain responds to this. Chronic back pain usually has the opposite pattern. And this is why one of the reasons why I wanted to make this video is because a lot of people will get confused about, this type of information. They think that, well, if this solved my back pain acutely, it should solve my back pain chronically, where no. Chronic back pain is often due to the opposite pattern of problems. And so I'm a prime example of, I chronically have an extension problem with my back. And for the most part, I have no pain at all, as long as I keep that in mind and I manage my back while doing that. However, this was an acute flexion episode, which needed me to respond to it in a flexion, from a flexion pattern point of view, which means I needed more extension. All right, this can happen. All right, so this was a lateral shift. It responded to this. It's still responding. I'm not perfect. The last thing I wanted to talk about was the interesting thing is, as I walk with my lateral shift, it feels to me that my left hip is jutting out. And you can even see here, I have still a lateral shift going on. And when I step on my left leg, I feel that the left hip is jutting out. But I've come to realize this past day or two that it's not that my left hip is jutting out. It's that my trunk is shifting to the right. And I still have, small spasms of back pain when I step incorrectly. And what I've noticed is during those episodes, when that's happening, it's because something has caused my right shift to transfer to the left too quickly, and it's pinching areas in my left spine. Interestingly, like I said, originally this was a central low back pain problem. It was so bad the whole back was just killing me. Now that it's resolving, I'm finding that the problem seems to be primarily on the left side, which to me gives more credibility to the fact that as I try to correct my spine over to the left side, I still have a disc bulge or herniation or whatever that event was that was occurring in my spine. It's still there to some degree, and if I try to too aggressively correct it, it irritates it and impinges it. And this is why I continue to have a slight right lateral shift. And this is why when I step, I feel like my left hip is jutting out, but it's not. It's really my right trunk going this direction. This doesn't happen when I step on my right side. I'm perfectly symmetrical. But when I stand on my left, then you see the shift occur. You can even look at the wrinkles in my shirt here. Standing on my left versus standing on my right. All right, so shift, no shift. Okay, and what you'll find is if you're in the middle of a lateral shift, you'll notice that standing on one leg is less painful than standing on the other. And for me, it's standing on my left leg that is more painful because it's causing my right trunk to shift to the right. When I stand on my right leg, everything's in alignment and I do not have weight-bearing stress going through my spine on this left side. And this is why it's less painful. But now that I weight bear on my left, everything shifts to the right, and so that's when pain starts to ensue. Okay? What little pain I have left right now. And so anyway, I hope this isn't confusing. Hopefully this will guide you in understanding what I think is going on with a lateral shift. And incidentally, this recent episode drove me to look at research of lateral shifts. And I feel that the research is going from the opposite direction, which is my usual complaint of a lot of medical research regarding musculoskeletal problems. And what most research is doing is looking at people with herniated discs to see if they have a lateral shift. Well, a herniated disc doesn't necessarily cause a lateral shift. It's a fairly rare event that I've seen clinically. So I don't expect all herniated discs or disc bulges to cause lateral shifts. I think when they are asymmetrical, they are a contributing factor to causing a lateral shift. And by correcting the lateral shift, that increases. So all the research is, that research was showing from that perspective that, oh, lateral shifts don't seem to be comprising, most of the disc herniations that are occurring out there. I would agree. I found it clinically to be a relatively rare event. That's not really helpful to me as a therapist in understanding what's going on with lateral shifts, or as a patient. So there's not a lot of good research out there about what is exactly occurring with lateral shifts. I wish there was. I haven't found it, but if you find it, please put it in the research below. And I would love to look at it closer. Anyway, that's what I have to report about lateral shifts. So what I'm going to do, I'm not going to push it. I'm just going to allow my shift to correct on its own naturally, because I'm feeling better and better every day, and I'm able to do more and more every day. Yesterday was the first day I was able to go up and down stairs. And so I'm going to allow my body to heal naturally, with the understanding that if I do get into trouble, I need to arch my back more. Or when I sit down, I need to arch my back more to keep correcting that disc issue that I believe I have. Sitting in lower chairs with more spinal flexion increases pain, and therefore, for me anyway, and it might for you too. And you may not understand that it's doing that because you haven't really thought about this as a problem with too much arch or too little arch in your spine. But if you start looking at the problem from that perspective, rather than whether you need to correct the shift, that might help you get through this episode. I hope that helps, and feel free to leave a comment below about this, or if you would like me to make other videos in the future, I'd be happy to do that.